Neo-Tuss is a combination medication used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin, one of the ingredients, works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. The other ingredient, Dextromethorphan, acts on a part of the brain to reduce the urge to cough. If you are considering using this medication, it's important to read the package instructions carefully before you start, to make sure it is right for you. Keep in mind that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. Always ask your doctor or pharmacist for more details about using the product safely. Remember that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions and do not use this product to make a child sleepy. It's important to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Neo-Tuss, it's important to follow the instructions given by your doctor or on the product package. You can take it with or without food, and make sure to drink plenty of fluids to help break up mucus and clear congestion. The dosage of Neo-Tuss depends on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take it more often than directed. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device or spoon. Don't use a regular household spoon, as it may not give you the correct dose. For powder packets, empty the entire contents onto your tongue and swallow, and for capsules, swallow them whole. It's crucial to not misuse or abuse this medication, as it can lead to serious harm such as brain damage, seizures, or even death. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's important to consult your doctor, as these could be signs of a serious medical problem. If you suspect a serious medical problem, seek medical help right away. If you experience dizziness, drowsiness, nausea, or vomiting while taking Neo-Tuss, make sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you outweighs the potential risks. Most people who use this medication do not experience serious side effects. Although rare, it's important to seek immediate medical help if you notice any signs of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As for the best time to take Neo-Tuss, it's important to follow your doctor's instructions. And regarding the daily dosage, be sure to take the medication as directed by your healthcare provider. If you have any concerns or questions about the side effects or usage of Neo-Tuss, don't hesitate to reach out to your doctor or pharmacist for more information. Before taking Neo-Tuss, make sure to tell your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. It's important to discuss any inactive ingredients in the product that may cause allergic reactions or other problems. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. Neo-Tuss may cause dizziness or drowsiness, especially when used with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and/or alcohol, be cautious when using the liquid forms of this medication. It's best to ask your doctor or pharmacist about using this product safely. It's important to note that the liquid forms and powder packets of Neo-Tuss may contain aspartame. If you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to use Neo-Tuss only when clearly needed and discuss the risks and benefits with your doctor. Additionally, consult your doctor before using this medication if you are breastfeeding, as it is unknown if Guaifenesin or Dextromethorphan passes into breast milk. It's important to be aware of potential drug interactions when taking Neo-Tuss. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal interaction. This includes medications such as isocarboxazid, metaxalone, and phenelzine. It's also important to avoid taking MAO inhibitors for 2 weeks before starting treatment with Neo-Tuss. Be sure to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan. Additionally, Guaifenesin may interfere with certain lab tests, so be sure to inform lab personnel and your doctors that you are using this medication. Be sure to consult with your doctor before making any changes to your medication dosage. If someone has taken too much Neo-Tuss and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. This can be done by calling 911 or a local poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If you suspect an overdose, it's crucial to act quickly and seek medical assistance. If your doctor has prescribed Neo-Tuss for you, it's important not to share it with anyone else. Make sure to attend all of your medical and lab appointments while taking this medication. If you forget to take a dose of Neo-Tuss, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Neo-Tuss, it's important to keep it at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom and refrain from freezing the liquid forms of this medication. Different brands of Neo-Tuss may have different storage requirements, so it's crucial to check the product package for specific instructions or consult your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. When it comes to discarding Neo-Tuss, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly dispose of the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.